Hi, and welcome to the I Report. Today, I will be speaking with you about baby blues and postpartum depression. Becoming a parent and giving birth can not only be a very exciting time in a mother's lifetime, but it can almost be a very emotional one as well. With all the excitement of being pregnant and becoming a mother's hormones are extremely high during pregnancy. But once she has the baby, the hormones are all over the place. A mother's emotions are having to adjust to normal levels despite all the excitement. It is just not the mothers who go through an emotional roller coaster, but also the man or father figure in the child's life can have a mixed emotions as well. Baby blues is when a mother or even a father can experience different emotions that usually last a few days until a couple weeks till they can adjust. After birth is a critical time for a mother and even father to develop the bond that a child needs. So it is very important that any sort of postpartum depression is dealt with so that that is out of the way and they can do what is needed to take care of their child, including bonding with them. Baby blues, which usually last only a couple days up to a couple weeks, usually isn't as symptoms include mood swings, anxiety, sadness, irritability, crying, decreased concentration, trouble sleeping, loss of appetite, insomnia, intense irritability and anger, overwhelming fatigue, loss of interest in sex, lack of joy in life, feeling of shame, guilt, and inadequacy, severe mood swings, difficulty bonding with your baby, withdrawal from friends and family, thoughts of harming yourself or your baby. Life after having a child is quite different, and some mothers may even go on to say that it can be crazy and even hectic, but it can be a very rewarding life with your children, and the bonding experience is incredible, filled with love and kisses and hugs that cannot ever be compared to. Our society is very secretive on such subject as mental health, but when it comes to our mental health, we need to make sure we're taking care of ourselves as much as we possibly can. But I think it's time for our society to realize that there is a very important part of our health, and that is our mental health. So when speaking to your doctor about such things as postpartum depression and even baby blues, please do not hesitate to talk to a professional. There is hope. There are programs out there that can help you. There are programs that can get you well. So it is important to make sure you're seeking every avenue to be well. If you think you have postpartum depression or even baby blues, don't hesitate to talk to a medical professional. It is important that you get the help that you need. So, if you need to, speak with your doctor. Don't be afraid and don't be embarrassed, because that's what they are there for. But, however, if you think that you're going to harm yourself or your child or even your children, make sure that you go to your local emergency room. If you're ever in the Tennessee area, specifically in the Nashville area, don't hesitate to call or even stop by the Hope Clinic for Women. Their phone number is 615-321-0005. And don't hesitate to ever go by, because they will help. Thank you for listening to this public service announcement brought to you by Mary Beth Rogers.